State leaders dedicated millions of dollars to new security structures, planning and training after last year's deadly Santa Fe high school shooting. Earlier on KXAN News at 5, we walked you through lawmakers' plans going into effect this school year.
Now political reporter Phil Prazen takes a closer look at a large mental health reform that's part of that solution.
State lawmakers were trying something new. They searched for the line between protecting child privacy and knowing when violent thoughts could turn into violent acts. It was a touchy issue for some with privacy concerns, like these parents who spoke at the Capitol.
As a mom, I will not stand by quietly.
Amen.
And while elected officials on both sides of the aisle work to destroy my state and my nation, and especially my children, I will not be quiet.
But the political will to do something after students and teachers were killed at Santa Fe succeeded in working through those concerns. The state will soon play an active role in student mental health. Texas has a long history of shortages in counselors and social workers, in psychiatrists, and in 2018, voters sent lawmakers to Austin to fix the mental health crisis that kept bubbling violently into view. Governor Greg Abbott named student mental health, along with school safety, an emergency item. Republican Senator Jane Nelson from Flower Mound, Texas, would make the cause hers.
There was a clamor for hardening our schools, putting metal detectors, and that's fine, but that doesn't address the root problem, and that is there are some children who need to be identified and helped as potential serious risks to themselves and others.
She had to find a way to provide more mental health services to the sprawling state of Texas, where communities can be geographically, culturally, and economically diverse. She decided to lean on a health infrastructure that already existed, pumping $100 million through the 13 health-related universities of higher education. They'd form the backbone to the Child Mental Health Care Consortium. Each university would partner with state agencies and nonprofits to provide child psychiatry centers local mental health professionals, school districts could tap into. To address that issue of privacy, none of this could be used without permission from a student's family.
So I want to clarify that no student health data would be compromised under this bill.
That is correct. And you're right. I don't think anybody on this floor is more protective of our privacy than I am.
The idea passed unanimously in the Senate, but needed fast action from House leaders to overcome a conservative Republican who found a procedural mishap that nearly scuttled the entire plan in the House. There, House Speaker Dennis Bonnen and his allies attached the consortium to the school safety reform bill that already passed, and the entire package was approved, and soon Governor Abbott signed it into law. Nelson sat to his right.
I heard from so many teachers and parents and pediatricians that they just didn't know where to go. They needed more than what was available to them.
In Central Texas, the regional hub will be the Dell Medical School at the University of Texas at Austin. In the next year, they plan to house counseling and mental health professionals students can use. Also, they hope to set up a wide array of telemedicine services so communities on the outskirts of Central Texas can use those services over internet video. They hope to get this up and running by next school year, and we're going to stay with this and watch its successes, its failures, and we're going to keep track of that privacy issue in the days ahead.
Thanks, Phil. The privacy concerns that you heard from the parent in that story are certainly something we're keeping in mind as our special coverage continues all week. And tonight on KXAN News at 10, we look closer at another controversial aspect of the state's plan. Districts assessing students on the likelihood they'll carry out a threat.
Online now, explore our digital project, Save Our Students, Solutions for Wellness and Safety. See why we're taking a closer look at this important topic. Stories from across the nation, in-depth conversations with school workers on the front line, interactive analysis of what's happening with mental health and your children, plus community outreach and resources to get help for your family. It's all online now at SaveOurStudentsTX.com.